we will have a discussion on an interesting topic, hair. The hair and hairstyle are the very important factor in our day-to-day life. So all of us love our hair for one or other reasons. So what we believe is the hair and hairstyle itself reflects the personality of a person. So what is hair? Actually, it is a protein filament, notably the alpha keratin, which grows from the follicles on the dermis. So this hair is one of the distinguishing factor, especially in the mammals. The hair can grow anywhere in the external body parts other than the mucous membrane and the glabrous skin like the palms and soles. And the hair growth that varies from person to person depending on the age, the hereditary factors and number of the environmental factors. Generally, it believes that each of the hair strand grows about 1 centimeter per month on average. But we should understand the fact that the thicker hair grows faster than the thinner hair, and once the age goes on, the hair growth usually slows down. Each of the hair follows a particular pattern of hair growth. So especially there are 4 stages for each of the hair stand. They are anagen, catagen, telogen and exogen. So how long in each of the stage each hair strand stands, that depends on the hereditary factors. We will just have a glimpse on each of these phases. So first is the anagen phase. So this is the growing phase. So in this phase, the hair usually grows about 1 centimeter per month, and this stage usually stays for about 3 to 5 years. And as I told earlier, it depends on the hereditary factors how long this phase persists. And each of these phase has their particular characters that we should keep in our mind. Then next is the catagen phase, that is the transitional phase. So this is usually stays about for 3 to 4 weeks generally. In this, what exactly happens is the follicles shrinks down and the papilla detaches, and usually the hair strands get cut off from the nourishing blood supply. So the hair will be in that stage itself. Next is the telogen phase, that is the shedding phase, though this may extend up to 3 months. So in this phase, the hair strand will be there in the follicles, but they actually will not grow. So this is the phase, there is no actual proper growth of the hair is happening. And last is the exogen phase, where the hair strand detaches from the papillas and falls down, that is the hair loss. So this hair loss, hair growth problems and other problems of hair related are starting when each of this phase of the hair growth cycle is disturbed. So other than any of the problem, hair loss is the most threatening problem which all the men and women at any age is facing. So generally we can consider this hair loss as the alopecia. So there are different factors which is causing the hair loss. So first of all is the hereditary factors, that is the androgenic alopecia. So this is happening when there is a history of hair loss or baldness in one's family. Obviously it will be transformed into the next generation also. So in women we can notice this as a gross thinning of the hair, and in men especially we can see it as a bald spot on the top of the head. Then other than the genetic factors, one of the other reason is aging. So once the aging is happening, automatically the hair growth tendency will be slowest down. Then due to the poor diet habit. Nowadays, as a part of dieting or due to the scarcity of food, many people are taking food which is deprived of the iron, zinc, then vitamins like A, C, E, all these things. These are all which is very much needed for the hair growth. So when we are not taking any of these things in our diet, obviously it will be leading to the hair loss. Then another one of the reason is smoking. Smoking is very badly affecting the hair growth patterns. Then few of the medical conditions like the scalp psoriasis, means the skin condition which is affecting especially on the scalp, then dandruff, then thyroid, then cancer, stress, COVID, then some infections like ringworm infection. So all these can also cause the hair loss. Then hormonal imbalance. So when we consider this hormone imbalance, PCOS is the main threatening thing. So when PCOS is happening in the body, obviously the testosterone levels will be increased. So this testosterone plays an important role in the hair loss. Then few medications like the medicines which we are regularly taking for the blood pressure, cholesterol, then other steroids, antidepressants, anticonvulsants, so and any antibiotic or antifungal medication. So along with this medication, as we all know, the chemotherapy obviously causes the hair loss. Then apart from this, few of the other reasons are mainly the stress. So when we are on stress, either physically or mentally, more than physically, mental stress is happening. We will not be taking care much about our hair, food, all those things. Our sleep will not be proper. So obviously this will be affecting our hair growth pattern. Then apart from this, other few bad habits, like nowadays many people are doing lot of experiments with the hair and hairstyle, like straightening, coloring. So many things are nowadays developing. Even the trichology, it's a branch itself is coming out. But with that name of the branch itself, many are doing the unwanted things on the hair and the use of cosmetics, like very hard shampoos, then other coloring agents. All these things which are using on the hair will also reduce the quality of the hair and prevents the hair growth. Obviously it will lead to the hair loss. So how can we prevent all these things? First of all, manage our diet. So in our diet include the food items like eggs, legumes, lentils, then green gram, almonds, walnut, salmon fish, then leafy vegetables, daily intake of ghee, buttermilk. All these things will improve the hair growth pattern. So along with this diet improvement, if still it is depriving of the vitamin, zinc and iron deficiency, we can take the supplements for that, including the omega-3 and 6 also. Then apart from the diet, the other things what we can follow to improve the hair growth are, one is yoga and Surya Namaskara. So when we are doing this yoga and Surya Namaskara, obviously it improves the blood circulation to the scalp and automatically improves the hair growth. Then the other thing is regular exercise and pranayama, once again which reduces the stress levels and improves the quality of hair. Then avoid smoking. Then the another thing what we can take care is, when we are sleeping or lying, just try to use the satin pillows which avoid the friction when we are turning side to side and all, which reduces the tendency of splitting of the hair or breaking of the hair and just prevents the hair loss again. When we consider these things in Ayurveda, we have a lot of treatments and medication, but depends on the severity of the condition only we have to take care of the medication. So if the one of the main thing what we advise in Ayurveda is the use of Murthini Taila, that is the head oil application. So depends on the severity. Once again, either as Shirodhara or Shirovasti even can be implemented in case of hair loss. And daily suitable oil application is very much appreciated in this condition. And one of the condition we consider it as the alopecia areata. That means a partial loss of hair as patches from the body. That can be from any part of the body, not only the scalp, even from the eyebrows and eyelashes. In such cases and all, we can do some prachana. That means bloodletting therapy, which improves the blood circulation over the affected area. Then suitable hair packs, which we can adopted in that case. And another one of the effective treatment which we gets result in hair loss is Nasya. When we use the Nasya, that is the nasal instillation with suitable medicated oils, once again it improves the blood circulation to the scalp and improves the hair growth. So hair is very important. Along with that, hair loss is very threatening. When we taken care of our food habits, lifestyle, and the following a healthy Ayurvedic lifestyle, up to some extent we can get rid of the hair loss. Thank you.